This is Dr. Anderson with North Texas Plastic Surgery, and today I'm going to go over just what exactly is a mommy makeover. A mommy makeover is when we combine multiple procedures as safely as possible. We can link to the safety video here, wherever. Multiple procedures during one anesthesia period, and I think for most people that's going to optimize time for recovery. Most people don't want to be in and out of the OR, have all these different recovery periods. So, mommy makeover, multiple procedures, different areas of the body. I'm going to go over the most common ones, kind of overarching things. I also did another lovely video about add-ons that people commonly do that we'll link to wherever I pointed before that was the right spot, whatever it may be, I don't know. And if you want to think about those things as well, you can watch that video. Most commonly, mommy makeover is going to consist of some sort of breast procedure and some sort of body procedure. So usually, the people that are going to come see me for this have had multiple children, and obviously, as their body changed through that, they're at a spot where they feel like things aren't ideal, and so they end up in my office. After children, breasts go through all sorts of changes. Who knows if they end up smaller, bigger? Frequently, they're going to end up lower. So breast is going to be probably the most individualized thing that we're going to talk about, because everybody has their own ideal vision of what the best boob is on their body. So that procedure is going to be a little more tailored compared to the other things that we'll talk about. If you come in, you'll start off chatting with my nurse, just because it's a little less intimidating. It's a little easier to talk to her about these things. So then we'll get a really good idea of which way we need to head after that. So coming in, if you feel like you're like the volume that you have, but too low, then we'll talk about a breast lift. If you don't like the volume that you have, meaning that you feel like you wish your breasts were larger, or you specifically want some roundness at the top inside portion of the breast, we're going to then talk about a breast lift with an implant. If you're in the group of folks that feel like they're too large, then we'll talk about a breast reduction. What's important to note is breast reduction is always going to include that lift as well. So we're not doing you any favors if we take your breast that you feel like is too big and leave it low. So it's always going to go up in addition to being smaller than where you start. Across kind of those three procedures, we need to think the first one, breast lift alone, you're going to end up a little bit smaller, but similar-ish size to where you were. Breast reduction, depending on where you're at, we're obviously going to be smaller, but we'll talk about where you want to end up and the degrees amount of smaller that you want to be. And then if we're doing implant, we have all the way from just a little bit bigger to a fair amount bigger. Now, in those conversations, it's going to be important to note, I cannot guarantee you an exact cup size, just because, as you know, depending on if you get your bra here or there, they may very well say the same exact thing but fit totally differently. But what's going to be helpful is we are going to try on some sizers in a sports bra, so you can kind of see in the mirror how that looks, and then we're going to do 3D imaging on your body. Now, it's not perfect, but it's a good estimation of where we're going to end up to make sure that the idea you have in your head of what's going to work for you and then what I can realistically achieve for you is going to be on the same page. After breast, then comes body. Now, the vast majority of folks that are going to come see me after their children for this mommy makeover are going to desire some sort of tummy tuck. Now, there's multiple benefits to tummy tuck, and there's multiple versions of tummy tucks as well. The benefits are it's going to remove excess skin, it's going to put muscles back together from any separation they may have had, and quite honestly, I'm going to overcorrect so they're tighter than they ever were. And then we're also going to increase flatness if we're looking in the mirror from the side, and optimize contours if we're looking at all other angles. Then the question becomes, because I know you know this already going into this video, which version of tummy tuck is right for me? So we have what I think of as least amount of skin removal going to most amount of skin removal. So people love to ask me about a mini tummy tuck, because realistically, a mini tummy tuck doesn't do much at all to treat skin excess. So if you are in the distinct minority of people that come in and really just have muscle separation but no excess skin, those are the folks that we can talk about mini tummy tuck and kind of dive deep into the ins and outs of that one. From there, we have standard tummy tuck, which is the version that we kind of think of as going hip to hip, even though it always goes a little bit past it. This is going to be for patients that certainly have some skin excess in the middle, maybe folks that have that C-section shelf that doesn't extend to the side. So these are generally folks that didn't really ever have any weight fluctuations and really just looking to optimize skin removal centrally, muscles tightened, those things that I talked about. What's honestly more common these days is the extended version of the tummy tuck. Now, I don't want people to think that extended version tummy tuck means overweight or anything like that. It absolutely does not. What it means is there's some loose skin going toward the side and even toward the back that will benefit from removal to optimize contours after surgery. A lot of folks, if not even the majority of folks, I can get you a smaller waistline and better contour if we extend that incision around the side, because I can tailor this back part a little more and get a little more narrowness in the waist to curviness in the hips afterward. But if there's skin looseness there, we may benefit from taking more. There's another subset of patients that are certainly in the Mommy Makeover category, but I think of generally more in terms of weight loss category. That is the circumferential or all the way around tummy tuck versus kind of lower body lift. I have more content out there that speaks specifically to those. We'll link to that as well. If you do a tummy tuck alone, it's obviously going to help flatten the tummy, but it's not going to totally optimize the contours that most women are looking for. I have never had a woman come into clinic and say that she wanted to look square in the hip. It's never happened. Someday somebody's gonna tell me this, I'm gonna fall out of my chair, but it hasn't happened yet. So if we're talking like standard tummy tuck and we just remove skin here, but we don't do any lipo around, the likelihood that your contour comes out less ideal is super high. So the absolute vast majority of folks when we do this tummy tuck are gonna have Lipo 360 as well. So what does Lipo 360 mean? To me, that means liposuction under breast down to pubic bone, armpit to hip, and then if you feel where your shoulder blade is to butt, all the way around. So that way we're treating excess fat areas in addition to excess skin, in addition to muscle repair, to optimize that contour after surgery. At the very most basic, that is what is included in Mommy Makeover. Like I said, you can watch that other content for a deeper dive into other things associated with Mommy Makeover. I have lots of other content about safety, more of what to expect before, during, after surgery that you will link to below as well. But I wanted to give you this slightly more brief overview. Again, this has been Dr. Anderson with North Texas Plastic Surgery. If you liked this content, please like, comment, and subscribe below.